Here are 5 Band 6 nurse interview questions and answers written by our expert interviewers from mockquestions.com. Question number 1. What is your favorite part of working as a nurse? The interviewers want to ensure you will be a good fit for the NHS. Most NHS Band 6 nurse positions say they seek a compassionate, motivated, and enthusiastic nurse in the job description, and your answer should reflect those qualities. My favorite part of working as a nurse is helping my patients feel more comfortable when they are sick or injured. When a patient is in pain, I love when I can give them pain medication that helps make them feel better. If a patient is cold, I like bringing them warm blankets. I will bring books or magazines if they want something to read. If a patient wants something cold to drink, I'll bring them a cold beverage. I grew up with 8 younger siblings and have always been a nurturing person, which is why I pursued a career in nursing. Question 2. Do you have experience training other nurses? At this point in your career, you should feel confident enough to train newer nurses. Describe your experience training others. If you do not have prior experience, explain that while you have no previous experience, you feel ready for this due to your expertise in educating your patients over the years. Yes, I have worked as a nurse educator for 3 years and trained the community on first aid, CPR, and AED. I've also taught nursing students at a local college and mentored new nursing graduates at the facilities I've worked for. I'm confident in my teaching abilities and look forward to this opportunity to bring my skills and experience to the NHS. Question 3. What would you do if you witness a nurse administering an incorrect drug or dosage? Situational questions are often asked during nursing interviews to see how you respond in certain situations, communicate, and use critical thinking and problem-solving skills. Be sure to mention that this incident would need to be documented in the patient's chart, and the physician would need to be immediately notified. If I witness a nurse administering an incorrect drug or dosage, I would quickly stop them while keeping a calm and professional attitude in front of the patient. I would pull the nurse aside, have them call the patient's physician or the attending physician, explain what happened, and ask what the doctor wanted the nurse to do to fix the situation. If the wrong drug or dosage were given, the incident would need to be documented in the patient's chart, and the patient would need to be told what happened. Question 4. How do you respond if you disagree with a doctor's orders? As a nurse, you may not always agree with a doctor's orders. Explain why you might disagree with a physician's orders and how you professionally and diplomatically approach them or your superior based on the company's protocols. If I disagreed with a doctor's orders and thought it would jeopardize my patient's health and well-being, I would follow my company's policy. During nursing school, I was taught that some organizations require their nurses to speak with a charge nurse or another superior who can then speak with the doctor, while others have the nurse who questions the order contact the physician with their concerns. I prefer speaking directly with the physician, but I will follow the NHS's protocols regarding this situation. Question number 5. Could you describe a time you had to quickly make a decision regarding a patient? Nurses must be able to think and act quickly, especially in emergencies. Describe a situation in which you had to quickly make a decision regarding a patient and talk about your actions and the outcome. 2 weeks ago, I was walking past a patient's room to check in on another patient when I heard vomiting coming from the room. I entered the room and found the patient on their back, unresponsive and vomiting. I immediately pushed the nurse's call button and rolled the patient onto their side so they would not aspirate. I then grabbed the suction unit at the end of the bed and started suctioning the patient's mouth. They started waking up, and my colleague walked into the room to see why the call button was pushed. I believe I was in the right place at the right time, as the patient could have aspirated or choked if I hadn't been walking by. Preparing for your Band 6 nurse job interview will take more practice than these 5 interview questions. Head over to mockquestions.com and get 30 more questions and answers for your interview.